Everybody, my topic is obstetrical and gynecological causes of backache. Now, backache is defined as non-specific backache that has lasted for more than 6 weeks but less than 12 months. It's more common in female as compared to the men. And in 90% of cases as such, there is no identifiable cause. And 40 to 90% people would experience at least one episode of backache during their lifetime, as already said by Dr. Bayatra. What are the causes of backache in women? In pregnant women especially, in backache in the women, and that can be divided into the obstetrical, gynecological and other causes. I am going to concentrate only on the obstetrical and gynecological causes. What are the obstetrical causes? Backache is common complaint during the pregnancy and prevalent in more than 50% of the patient. This pain can begin even before 12 weeks of pregnancy and may last up to 6 months after delivery. The common risk factors are history of pre-pregnancy backache and multiparity. What are the causes? The common cause is a strain on back and abdominal muscles and ligaments because of the extra weight of the pregnancy. Pregnancy causes more lordosis and causes the postural abnormalities that would further aggravate the backache. And pregnancy hormones, especially the relaxin, causes a marked laxity of pubic symphysis and sacro-iliac joints, and that would further lead to the backache. But most important thing, before concentrating on any cause of the backache, we have to keep these causes in the mind. Patient is not in the process of abortion, or she is not having incompetent cervical os, she is not in preterm labor pain. So whenever patient is in the process of the abortion, she will present as a backache. So this is very important to differentiate whether she is having backache because of these conditions or because of the muscle strain only. In rare cases, even with the accidental hemorrhage, patient may present with a backache. Backache can be classified into lumbar pain, sacro-iliac pain and nocturnal pain. Lumbar pain may radiate or may not radiate to the legs and is common during standing and sitting position, mainly because of the postural abnormalities. Sacro-iliac pain is over the spine and near the posterior superior iliac spine, and it may radiate to the posterolateral thigh. It's more common than the lumbar pain, and this type of the pain can continue several months after delivery. Nocturnal pain is common when patient is in the recumbent position and mainly because of the SI joint dysfunction. Now, before coming to the management, before starting any treatment for the pregnant patient, we have to rule out this patient is not in the process of abortion, patient is not having the incompetent os. So pelvic examination and ultrasound is very important. Ultrasound would tell us the cervical length and internal os is closed, and pelvic examination would differentiate patient is not in a labor, so we can start the treatment. The mainstay is physical therapy, that patient should be taught to learn the exercises which help in stretching and strengthening the back and abdominal muscles. Postural correction should be explained. She should avoid high heel shoes, lifting heavy objects and standing for long periods of time. Hot and cold water fermentation is safe during pregnancy, but short-wave diathermy, therapeutic ultrasound and intermittent traction should be avoided. If patient needs medication, then acetaminophen is drug of choice, and external application of pain-reducing ointments and spray can be advised, but NSAIDs should be contraindicated as they may cause premature closure of patent. It's very important to differentiate this backache is because of the gynecological cause or because of the muscular strain only. So how will you differentiate? When pain is because of the gynecological lesions, it's always diffuse, usually in the midline or with the bilateral distribution. It's over the sacral and lumbosacral area, but never higher than the 4th lumbar vertebra. And when any pain can be pinpointed with the finger and associated with the local tenderness, is usually not because of the intrapelvic lesion. Now, a word about each gynecological cause. Uterine prolapse as such does not cause pain, but dragging on the uterosacral and cardinal ligaments causes pain, and typically it is relieved by lying down. Chronic cervicitis and cervical erosion also do not cause backache when there is a gross scarring and chronic cellulitis in the adjacent ligaments that leads to the backache, but it does not relieve by lying down. Uterine contraction, especially when uterus in the process of the abortion or when tries to expel the polypoidal growth or blood clots from the cavity, then it leads to the backache. When there is an inflammatory involvement of the pelvic cellular tissue and uterosacral ligaments, as in the PID, that is also leads to the backache. Similarly, in the endometriosis, when there is a infiltration of the pelvic cellular tissue and uterosacral ligaments, leads to the persistent backache that gets worse during the premenstrual period and menstrual period. As such, the large pelvic tumors, when they are impacted in the pelvis, they also cause the backache. So one has to differentiate. Patient is not having a tumor. And any malignant extension from the cervix, uterus and ovaries, especially when there is a sacral plexus involved and there is a spinal metastasis from the pelvic cancer, they will present as backache. Other causes includes the post-operative period, especially during the gynecological surgery. Patient is in the lithotomic position for the prolonged time would lead to the strain on the muscle and backache. And osteomalacia and osteoporosis, they are the common causes of in the females, and especially in the advanced age, and they lead to the backache. Now coming to the management, most important, we had to treat the cause. So we have to reach the diagnosis by meticulous history examination, including the pelvic examination. And ultrasound is a very important diagnostic tool to confirm the pelvic pathology. X-ray, MRI, as already said by Dr. Ranjan, can be done if whenever they are required, and treatment depends on the cause. If there is no cause, then assurance, correction of the postural, abdominal exercises should be explained to the patient, and patient learn to organize her life to get periods of rest. And in more severe cases, orthopedic opinion and a specific opinion can be taken. So in the end, the carry home message is low backache during pregnancy should be given special attention because causes are specific and specific treatment can be geared towards the precise pathology. And common gynecological causes of low backache are malignant, endometriotic and inflammatory infiltration of the pelvic cellular tissue and uterosacrals. So whenever female patient presents with a backache, she should be evaluated appropriately and should be referred to gynecologist in time so that the specific management can be planned. Thank you.